Hey, welcome. So, in the massive world of wellness, IV therapy has absolutely exploded. But today, we're not just talking about the drip itself. We're going to focus on a really critical and honestly often overlooked question. Who is the person actually holding the needle? Let's dive into why expertise behind that needle is so important.
It's so easy to see the appeal, right? IV therapy promises to jack up your energy, supercharge your hydration, and just support your overall health. It feels like a direct shortcut to feeling your absolute best. And, well, that's exactly why its popularity has gone through the roof. But with all these drip bars and mobile services popping up everywhere, we have to ask a really important question. See, administering an IV isn't just some wellness service. It is a full-on medical procedure. So who is guarding the gate to your veins? The answer to that question is everything when it comes to your safety. Okay, first up, let's really break down why this trend has gotten so huge. I mean, from pro athletes looking to recover faster to busy professionals just trying to dodge burnout, it seems like everyone is searching for that edge, a more efficient way to feel great. And the reasons are pretty compelling. We're talking direct energy boosts, way better hydration, and serious immune support. But the real game changer, the thing that drives it all, IV therapy completely bypasses your digestive system, which means you get faster, way more efficient results than any pill could ever offer. Okay, but here's where we need to get serious for a minute. As amazing as all that sounds, we have to remember this is a medical procedure. And when it's done by someone without the right training, that simple wellness boost can turn into a real medical problem, and fast. And believe me, it doesn't take much for things to go sideways. Just look at how one single mistake can start a domino effect. An untrained person picks the wrong vein. That immediately causes pain and some nasty bruising. And from there, you can get something called infiltration, which is when the fluid leaks out of the vein into your tissue. It's a chain reaction you want absolutely no part of.
And yeah, it can get even worse. We're talking about serious infections from non-sterile equipment, phlebitis, which is a really painful inflammation of the vein, and even permanent damage to your veins or nerves. And in very rare but very severe cases, something called an air embolism can happen. These are not risks you want to be gambling with.
So what's the solution here? It's actually pretty simple. You only entrust this procedure to licensed and experienced specialists. This isn't just a suggestion. The source material is crystal clear that for your own health and safety, this is absolutely non-negotiable.
Okay, let's break this down, because this slide just lays it all out perfectly. On one side, you've got the gamble. You're risking infection, vein damage, and you're getting a generic one-size-fits-all dose that might not even be right for you. But on the other side, you have the standard, a licensed specialist using sterile techniques, picking the exact right vein, monitoring you the whole time, and giving you personalized, effective care. I mean, the choice is pretty clear, right?
So, what exactly should you be looking for? A qualified IV professional is a licensed medical pro. We're talking a registered nurse, a nurse practitioner, or a physician assistant who has specific certified training in giving IVs. Seriously, don't settle for anything less. Now, let's talk about the expertise advantage, because a real professional's value goes so far beyond just placing the needle correctly. It's all about the deep medical knowledge they bring to your treatment. Now, this is really interesting. This quote calls the gut a fickle gatekeeper, and that is such a perfect metaphor. It really gets to the core scientific problem that IV therapy is built to solve. Think about it. The vitamins you swallow have to go on this brutal journey through your entire digestive system. And this chart just paints the perfect picture. When you pop a vitamin pill, your body might only end up absorbing a tiny fraction of the good stuff, sometimes as little as 20 or 30%. The rest, it just gets lost along the way. It's wildly inefficient when you think about it. And this is the big payoff. With IV therapy, you get 100% bioavailability. Every single drop of those vitamins and minerals goes straight into your bloodstream, getting to the cells that need them, like right now. No fickle gatekeeper, no waste. And this is exactly why that professional knowledge is so critical. A trained specialist actually understands the vitamins themselves, they know about potential drug interactions, and they can assess what you specifically need. They can customize the formula and even the drip rate just for you, and most importantly, they know exactly what to do if any complications pop up. It's the whole package. So, now that you're armed with all this info, how do you make a safe choice? Let's walk through a really practical checklist you can use to find a reputable provider and, protect your health. Okay, this is the key takeaway right here. Before you even think about booking, run through this list. Verify their credentials. Are they actually registered nurses or nurse practitioners? Ask them about where they get their ingredients and what their safety protocols are. Check out recent online reviews. And this one's huge. Make sure they offer a personalized consultation. Any good reputable clinic will be totally transparent about all of this. And that really brings us to our final thought for today. As you navigate this whole wellness world, it's worth asking yourself this one question. When it's your health, your body, your bloodstream on the line, are you just looking for a service or are you looking for an expert? The answer could make all the difference. Thanks so much for tuning in.